Whether it's sleep apnea or seasonal allergies, millions of Americans deal with some kind of breathing issue. To alleviate these problems, many turn to surgery. In fact, one of the most common nose procedures fixes blocked nasal passages. The effects can drastically improve a patient's quality of life. But in some rare cases, people are left feeling like they're constantly suffocating. The condition called empty nose syndrome affects a very small number of patients, but is a disorder that's been the cause of suicides and even murder.
This guy ended up getting empty nose syndrome. He kept going back to the surgeon, and the surgeon told him there was nothing wrong with his nose, which is a very common thing. And he eventually murdered the guy, and then they actually ended up executing him later on because he had murdered his doctor. So it was a very sad story. You have this minor procedure. You then come away basically crippled from it, and you go back to doctors looking for help, and they basically tell you there's nothing wrong. And so if you look at a lot of the ENS online forums, there's a lot of really angry and desperate people.
That's James R. Skinner. He suffered from terrible sleep apnea and nasal congestion for years before deciding to go under the knife. Skinner lives in a rural town in Nova Scotia, Canada, and had to travel to the U.S. for 2 procedures.
After I had those surgeries, he said, I've taken the nose as far as I possibly can, and that I shouldn't have any more nasal surgeries. He actually at that time mentioned the risk of empty nose syndrome.
And though he says the procedures helped a little, Skinner continued to battle his sleep apnea over the next 2 years. When it became unbearable, he sought out a doctor near his home.
I was actually quite desperate to get the sleep apnea under control, and we were exploring possibilities of surgeries for that. Anyway, he felt at that point that I was still having enough troubles with my nose that I should have another procedure on my nose. I explained to him at the time that I had been told in the US that it would be unsafe to do so, but he felt that it was safe and went forward with it. And unfortunately, that's the procedure that ended up giving me empty nose syndrome.
Empty nose syndrome, or ENS, was first discovered in 1994, though much of the condition still remains a mystery to this day. Dr. Brent Sr. has researched ENS for several years. He's the chief of rhinology, allergy, and endoscopic skull-base surgery at the University of North Carolina at Chapel Hill. Sr. says doctors aren't completely certain what causes the disorder.
There are theoretically people that can have empty nose that have not had surgery, but probably 99% of the patients who do develop this very unusual condition have had surgery of some sort on their nose and sinuses.
ENS symptoms can range in severity, but many who suffer with the syndrome report a chronic feeling of suffocation. Even though the nasal passage is completely clear, patients feel like they aren't able to breathe in any air through their nose.
It's a feeling of a lack of sufficient nasal resistance in the nose. And the second symptom is a feeling of lack of sensation of airflow. So, for example, the lack of sufficient nasal resistance produces a difficulty in getting a deep breath. So I feel short of breath constantly, basically. And so that produces a significant amount of fatigue. On the feeling of suffocation, this lack of airflow sensation the brain seems to really want to know when you're breathing, which makes sense. And it seems to trigger a overactivation of the brain, sort of a fight or flight kind of sensation. And you always feel like you're not getting air.
In order to find some type of relief, Skinner will put cotton balls in his nose as a way to increase the air resistance. He's lived with his condition for more than a decade, and doctors still don't know what part of the surgery caused ENS.
The surgery can go 100% according to textbook accuracy. I mean, it's exactly the way someone may want to do the surgery. But what happens is that in some cases, if the nose is opened too much, so the septum is made straight and the turbinates on the sidewall of the nose are reduced too much, then that leads to a very large amount of airflow. It's almost analogous when you think about sucking through a straw. You can sense that movement of fluid or movement of air through that straw. But if you made that straw the size of a pipe and you did that same maneuver where you suck on the pipe, you wouldn't appreciate the movement that's occurring. And we think there may be something to that relationship of just the size and the sensation of the airflow going through that causes people to have this condition.
The nose is an extremely complex organ, and turbinates are just one of the functioning structures inside it. They regulate airflow and warm the air you breathe in. But Senior says if the turbinates are reduced too much, it can cause ENS on rare occasions.
It is that paradoxical sensation where you have a very widely opened nasal cavity. I can look into it with a light or with an endoscope, and I can see things are very wide open, heading all the way back to the throat. And yet the patient feels that their nose is completely blocked. So despite the fact that physically it's open, they have very little sensation of airflow, allowing them to have a sense that their nose is actually open.
Senior thinks developing the condition may depend more on the patient instead of the actual surgery.
You could have the exact same physical result. We could do measurements. We can do something called acoustic rhinometry, which is almost analogous to like sonar in your nose. It creates this vision of the airflow going through the nose and showing us where blockages are. It can look exactly the same, and yet one person will feel totally blocked and the other person will feel completely great.
Unfortunately, Skinner was one that ended up being affected for life. Though it took a few months for the ENS symptoms to show up, he knew something was wrong right away. And when he returned to the doctor to try to solve his new problem, Skinner says the surgeon was reluctant to believe him.
I think I ran into something that I think a lot of ENS patients ran into, and that this procedure is considered a fairly minimally invasive procedure that they do all the time. And, when they have a patient that comes back who says this procedure has dramatically changed their life, they seem quite skeptical. At first, he seemed a little bit open to it, but as time went on, I think he thought it was all in my head.
Over the next several years, Skinner participated in various research studies and sought out potential treatment options. Since the cause seemed to be related to taking away too much tissue, why not just use an implant to replace what's missing? Well, Senior says it's not that easy. Turbinates are constantly changing, swelling at one moment, then shrinking the next.
The turbinate actually has a cycle even where we can photograph the turbinate throughout the day, and we can see that one side gets a little bit more congested for a few hours, and then it just slowly decongests. And the other side oftentimes is doing the exact opposite. It's decongesting, and then it's swelling, and then it's decongesting. And there's like this rhythm that's going on. And it's a rhythm that we've actually been able to measure. And we see that rhythm even changing as a patient gets older. So it's quite a dynamic structure. The nose is a living, dynamic organ. And so just replacing the lost tissue with an adynamic, just static piece of something to block the airway, it just isn't perfect.
Desperate for treatment, Skinner has tried injections. The first trial provided relief, but only for a very short amount of time. While scientists are still searching for a permanent treatment option, Senior has also been looking at potential indicators that can make patients more susceptible to ENS. His 2022 paper, published in the International Forum of Allergy and Rhinology, studied the relationship between ENS and mental health. The research found that ENS patients have a much higher rate of depression and risk of anxiety. But Senior says a more interesting finding is the elements of OCD present in the patients.
In particular, we found a condition called body dysmorphic syndrome was apparently present or at least suggested by the questionnaires in a very sizable percentage of the patients. And so that was a very novel finding. Body dysmorphic syndrome is a condition where patients tend to hyper-focus on a specific part of their body with an abnormality, and they can't not focus on it.
Senior thinks this discovery could open up new opportunities for treatment and has also started to think about screening all of his patients for mental health issues prior to surgery. You can find more information about James R. Skinner and Dr. Brent Senior on our website, radiohealthjournal.org. This segment originally aired in May 2022. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.